Hey everyone, welcome back to the channel. Rabies is an acute, progressive viral disease that affects the central nervous system. It's one of the deadliest infections known to medicine. Once clinical symptoms appear, rabies is almost always fatal. However, the most important thing to remember is this. Rabies is completely preventable if managed early. Rabies causes approximately 60,000 deaths every year worldwide. More than 95% of human rabies cases are transmitted by dogs. The disease is most common in Asia and Africa, where access to vaccination and post-exposure treatment may be limited. The rabies virus is a negative sense, single-stranded RNA virus. It has a characteristic bullet-shaped appearance. Rabies belongs to the Rhabdoviridia family and the Lyssa virus genus, which explains its strong neurotropic behavior. Different animals act as reservoirs for rabies. Globally, domestic dogs are the most important reservoir. In some regions, wild animals such as bats, foxes, and raccoons play a major role in transmission. Rabies is transmitted through the saliva of infected animals. The most common route is an animal bite. Less commonly, scratches, mucosal exposure, or even organ transplantation can transmit the virus. After a bite, the virus enters the body through broken skin. It initially replicates locally within skeletal muscle cells. During this phase, the virus binds to nicotinic acetylcholine receptors at the neuromuscular junction. Once inside peripheral nerves, the virus travels toward the central nervous system. It moves by retrograde axonal transport. This mechanism allows the virus to evade the immune system and spread silently. When the virus reaches the brain, it spreads rapidly. It causes severe inflammation known as encephalitis. The brainstem and limbic system are particularly affected, leading to emotional, autonomic, and motor disturbances. The incubation period of rabies is usually between 1 and 3 months. However, it can be much shorter or longer. Bites closer to the brain, such as on the face or the neck, result in faster symptom onset. The disease begins with non-specific symptoms. Patients may experience fever, fatigue, headache, and pain or tingling at the bite site. This stage usually lasts several days and is often mistaken for a common viral illness. This is the most dramatic stage of rabies. Patients develop hydrophobia, which is fear of water, and aerophobia. Severe agitation, hallucinations, and autonomic instability are common and highly characteristic. Not all rabies presents with agitation. Paralytic rabies causes progressive muscle weakness and paralysis. It can resemble Guillain-Barré syndrome and is more commonly associated with bad exposure. Rabies is primarily diagnosed clinically. Laboratory tests include PCR testing with saliva, cerebrospinal fluid, or skin biopsies. Negri bodies can be seen in brain tissue after death, but this is not useful for early diagnosis. There is no effective cure once rabies symptoms appear. Treatment is supportive and focuses on intensive care. Experimental approaches like Milwaukee Protocol have rarely been successful. Post-exposure prophylaxis is life-saving. It includes immediate wound washing. This is followed by rabies vaccination and rabies immunoglobulin, which neutralizes the virus. The most effective prevention strategy is mass vaccination of dogs. High-risk individuals may receive pre-exposure vaccination. Public education and early bite management are critical in preventing deaths. Rabies is 100% preventable, but once symptoms appear, it's almost always fatal. Early recognition and immediate post-exposure treatment save lives. Thanks for watching. If this video intrigued you, don't forget to like, subscribe, and join me next time as we uncover more mysteries of medicine. See you next time.